So, I mean, that did change things. But if the chronic condition itself is not the thrust of the treatment, it's not being treated tonight, it's not relevant to the stay, then, you don't necessarily have to have it. However, take a look at the top of page 26. There are some chronic conditions, such as, but not limited to, hypertension, Parkinson's, COPD, and diabetes, that ordinarily would be coded even in the absence of documented intervention or evaluation. And that's something you want to write down. There are certain diseases that when they occur with the patient, even if it's not documented as a problem, you need to pull it out. Is diabetes the type of disease that can affect other diseases? Oh, yeah. Does COPD come into play with all kinds of other diagnoses? Oh, yeah. What about your hypertension? Oh, yeah. And then Parkinson's disease. So if it's a chronic disease of enough magnitude that it's going to affect the treatment of other diseases, then you go ahead and put it down. Particularly if it's the type of disease that's going to affect the patient for the rest of their life. Now, diabetes, particularly diabetes type 1, a few years ago I would have said to you that once you have it, you always have it, wouldn't I? Under what circumstances have they now found that a patient with type 1 diabetes can be no longer diabetic? That you're getting there.
Exercise.
You're getting there, but it's above and beyond that.
It's above my tongue, I guess.
No, you're all right. It is a surgery that was done for totally different reasons, and they have learned in doing it that immediately upon the surgery, the patient is no longer diabetic. What is that surgery?
I do not know.
Gastric bypass. Gastric bypass. Gastric bypass, as a result of that, is now being used to treat diabetes in patients who have such severe diabetes that they're going to have very severe complications. I have a friend who was not obese, had gastric bypass because of her diabetes. The doctor told her to leave her syringes and everything home because when she walked out of the hospital, she would no longer be diabetic. And she wasn't. And that's pretty. And they're still trying to determine exactly why that's happening. But yes, it is now also a treatment for diabetes. Not every patient it would be appropriate for, but certainly it's something that you need to look at. It's extremely interesting. Okay, take a look at number 4. Conditions that are an integral part of a disease process should not be reported as additional diagnoses unless otherwise instructed by the classification. Again, this is very similar to the rule about when you have a symptom that's explained by way of a diagnosis, don't code the symptom. This is like if you've got a condition and you know that condition is going to happen with this other condition, don't code it. An example would be ascites. What is ascites? A-S-C-I-T-E-S. Abdominal distension from fluid. All right. Is ascites something that happens when you've got Leydig cirrhosis, alcoholic cirrhosis, or excuse me, Leydig is not always alcoholic cirrhosis, but when you have Leydig cirrhosis? Yeah. One goes along with the other. All right. So is ascites pretty much an integral part of the Leydig cirrhosis? Yeah. And so typically we wouldn't report it unless we were otherwise instructed to do so by the classification system, or unless the ascites itself had to be treated. So if I go to the hospital and I've got cirrhosis and I've got ascites, and they're just treating the cirrhosis and they don't do anything for all this fluid in my abdomen, do I necessarily code the ascites? No. But if while I was there they also drained the ascites, would I code it? Then I would. See, some of this is just common sense, thinking through it, kind of breaking it down in small pieces. The examples they've given you, A patient with NNV, nausea and vomiting due to infectious gastroenteritis. We're not going to code that nausea and vomiting because that's a very common symptom of gastroenteritis. Number 2, patient has severe joint pain and rheumatoid arthritis. You're going to have joint pain with arthritis, so we don't code that. All right, now, number 5, conditions that are not an integral part of a disease process should be coded when present. Okay, patient comes in by ambulance following a CVA at work, a stroke. Patient was in a coma, gradually regained consciousness. Diagnosis at discharge was a cerebrovascular thrombosis with coma. In this case, coma is coded because it is not implicit in a cerebrovascular accident and is not always present. Oh, so if it's not always there and it occurs, then we do code it. And the second example, 5-year-old boy, 104-degree fever with pneumonia. During the first 24 hours, he had convulsions due to the high fever. Both the pneumonia and the convulsions are reported because convulsions are not routinely associated with pneumonia. Fever is commonly associated with pneumonia, however, and no code is assigned. So you have to kind of look out, is nausea and vomiting goes along with gastroenteritis. Chest pain goes along with an MI. So do you code those things? No. All right. Abnormal findings. I think we need to look in the code book as we look at this. Let's look at code 790 through 796. You can code every abnormal test that can be done on a patient in some shape, form, or fashion. Now, whether you want to is a different story. All right, when you look at 790 to 796, you see that the title says that these are non-specific abnormal findings. Non-specific, kind of general, don't really say anything, don't give us a lot of detail, just tell us that something's wrong and doesn't really tell us why those things are wrong. All right, they should be assigned only when the physician has not been able to arrive at a related diagnosis but indicates that the abnormal finding is considered to be clinically significant by listing it in the diagnostic statement. Are you going to remember that? No. So what you're going to do is you're going to turn right here in your book, and we're going to write that in this book. Now, does that mean that every time you get a new book, you've got to transfer your notes over? Yeah. Some people use Post-it notes, and that way they can just transfer the Post-it notes over. Others are fearful that they'll lose the Post-it notes, so they just write it in. But right here under 790 to 796, I'm drawing a big circle around.